Good afternoon, everyone, and apologies for being a bit late to start this. So for those of you who don't know me, I'm Jac Matheson. I'm the Chief Nursing Officer here at Peter Mac, and very pleased to be joined by Dr. Ben Tay as we talk more about the COVID vaccine program today, and also Jai, who will be very helpfully fielding all of your Menti questions for us. So this session is really, I know that Shelley and Leon did a live yesterday around all things update around COVID. So this session is really focused around the COVID vaccine. So if you've got specific questions and around that, please feel free to shoot them through. Just a reminder that Ben is not able to provide you with individual medical advice on this call. And if you are, or if you do have personal concerns around whether or not you're eligible, we definitely recommend that you see your treating practitioner for that, but happy to take any general questions that come through. Just a couple of quick updates before we start. As many of you would have heard, there's another 13 cases today and lockdown has been extended for another 7 days, so until Tuesday midnight next week. Definitely, I think that is pretty anxiety provoking for a lot of people. I think it's pretty tough being in the 5th lockdown with lots of uncertainty. I know that people are cancelling trips away and also have had family that can no longer come and see them here, etc. So just be really mindful of that. Be really mindful of, with one, how you're feeling and how you're coping, but also just those around you too. I think everyone responds to these things differently. So please do take a moment to check in, with yourself and let us know, or your manager know, if things are getting really stressful for you, and we will help put strategies into place. And likewise, just maybe take the time to reach out to your colleagues too, particularly those that are working from home. You know, we sometimes forget that the team is split across multiple different sites, etc. at the moment, so just be mindful of that. Before I hand over to Ben, who will give us the update on the COVID vaccine, just a reminder to Shelley, for those of you that tuned in yesterday, you would have heard the update on the flu vaccine. Many of you will be hearing the daily announcements on the PA. Please take note of them if you haven't yet had your flu vaccine. Really important that we get our numbers up around this. Although COVID has been the push, we still do need to make sure that our annual influenza vaccine campaign is right up there, and that as many of us as possible get vaccinated. So I know that many of you may have accessed again the vaccine outside of Peter Mac through your GP or local pharmacy. So just make sure that you fill in the red cap about that, just so we can keep track of who's had it and who hasn't, but really important program. So just make sure that you are getting onto that as well. But I will hand over to Ben, who will just give us a bit of an update on where things are at with Pfizer and AstraZeneca, and then we'll open to questions. Over to you, Ben.
Great. Thanks, Jac. Hi, everyone. I think, a few of you guys might already be aware of the changes, but certainly, the state government's prioritizing healthcare workers as a key group, especially in the next couple of weeks, to get vaccinated. So certainly for those, and healthcare workers have been eligible for a while, but essentially anyone now, healthcare worker who has not had their first dose of vaccine, can access the Pfizer vaccine at any of the state-run hubs from now onwards. And there's actually capacity there set aside, particularly just to target and to make sure that healthcare workers do get vaccinated. So that's one of the key changes in terms of Pfizer eligibility. But again, this is people who have not started their vaccination process. So if you have started, of course, with your first Pfizer vaccine, it's very strongly encouraged that you complete your second Pfizer vaccine. And for those who've had their first dose with AstraZeneca, regardless of age, the strong recommendation is that you complete your second dose of AstraZeneca as scheduled. And certainly, as we know, with the Delta variant that's going around in Melbourne and in Sydney, that 2 doses certainly offer more effective protection against severe complications from COVID. So it's even more important that we get our 2 doses of vaccines of either type. The other sort of more broader change in recommendations, of course, since we last spoke, is that certainly for 59 and below, that Pfizer is the preferred vaccine at the moment, and certainly for 60 and above, it remains AstraZeneca. And I think with that, I'm sure we can open for questions.
Yeah, awesome. I might just add one thing just to let everyone know, because we do get asked this a lot, that at the end of June, when we last did the database check, we were sitting at 69% of staff that had either had 1 or 2 of their COVID vaccines across the organisation. So it's awesome, but we certainly want to see it higher than that. We are doing the second audit now, so we will be able to update the organisation with where we're at probably early next week. But if you are on the fence and haven't yet decided to have it, now is a good time to book in and start that process.
Yeah, I think, understandably, some people might have been a little bit hesitant because of their concerns with AstraZeneca, and that shouldn't be the case now, especially since, the criteria has opened up for people who've not had their first dose. So we would strongly encourage you to have your vaccine. And as Jack mentioned right at the start, if there's particular concerns, then certainly talking to your treating practitioner to address those concerns, I think would be important.
Yeah, awesome. Thanks, Ben. Great summary. Over to you, Jai.
Thanks, Jack. First question says, do we know why so many staff aren't getting either vaccine? And I think you just touched on, and will we collect any data on it?
So no, we won't collect data on who's not getting it and why they're not getting it. At the moment, the vaccine isn't mandatory. It is strongly encouraged. So, certainly I know some staff that are pregnant, certainly choosing not to get vaccinated at this time point. So everyone will have their own personal reason. The biggest thing that we can do is just strongly encourage those to make an informed decision. And for those that haven't yet got it, just to make sure that they get the advice that they need to feel confident in getting it.
Yeah, and to that point, that's also been a change in recommendations, or an update to the recommendations in the last couple of months. That certainly in terms of pregnancy or people intending to be pregnant, certainly, or currently pregnant, that the College of Obstetrics and Oncology together with ATAGI put out some guidance to certainly recommend pregnant women can access Pfizer vaccines as part of the program.
Yeah, really good point, Ben.
Yeah.
So that addresses one of the questions we had, which was around pregnancy. There's a comment here saying the vaccination clinic at the Royal Melbourne Hospital is now closing on certain days as they are understaffed. This is not helping the vaccine rollout.
I think it's not that they're understaffed. I think a lot of it is also to do with the supply and just where it is best to set up the clinics. So as you'll know, there are the big clinics at the convention centre and the exhibition buildings, which we can book into and access. The Melbourne clinic was set up as quite a small staff-only clinic right at the word go. So they do still have their Monday to Friday service, as much as Ben was researching quickly before we jumped online. So you should still be able to book there, but otherwise the big hubs are certainly accessible to all.
Yeah, I think the best thing to do is certainly, if you're registered on the state system, the EMS system, then you can actually look at what's available across all the sites that you prefer. So I think that's the best place to go, rather than to pop over there and then find that there's no availability. You can check it from your desktop, basically.
Yeah, agree.
Next question says, some of my under 40 colleagues, non-healthcare worker friends, are asking for advice about getting the AstraZeneca vaccine. Would you recommend that they get it?
Yeah, so again, it's not something we can sort of recommend to broad groups of people without knowing their personal circumstances. So certainly, I think the vaccine is licensed from 16 to 18 onwards, depending on which vaccine. So it is certainly licensed from that point of view. But I think the current recommendation is that anyone who is younger than 60. It's just because it's all around the perception of risk and also the risk of the TTS, which is the thrombosis and thrombocytopenia syndrome. So I think everyone's assessment of risk is very different, and of course then it.
Go get your flu vax. Good timing.
Is available from now until 3 p.m. Level 1, Wellbeing Centre. Please remember to bring your Medicare number.
Oh, there you go. Good reminder. Sorry, what was I'll say is I think for people who are young and 40, I think it is the the recommendation is to actually make a time with your practitioner to talk through these, risks and benefits, for your personal circumstance. And if the decision after that, after having that discussion, is that you feel comfortable, going ahead with it, then certainly, that's something they should do. I don't want to sort of say broadly everyone should, under 40 should should go out and get the vaccine without understanding each person's sort of circumstance. So, but I mean, that being said, for all healthcare workers under 40, you'd still, obviously qualify for the Pfizer vaccine under the state program, and we would encourage you to do that.
Great.
The next question says, do you think the heterologous vaccination will be allowed soon for under 60s? The results of the 3 to 4 studies show that antibodies and T-cell responses are good. Why is Australia still holding back? Yeah,
look, great question. I think, I agree that the studies that are coming out show tremendous promise, I think, for what we call a mix and match schedule. So a different first dose with a different second dose. But I think, as I guess the question has alluded to, I suspect the recommendations won't change until there's sufficient supply of an alternate vaccine. I guess, it's hard to sort of recommend a different, a mixed schedule if there's inadequate supply. So, but I'm not on a taggy or anything like that, so I can't I can't say that's the reason. But I think, I guess, there should always be a conscious sort of that must play in their consideration as well. But I mean, that being said, I think completing, as we facing the current outbreak, I think I think it's still important that 2 doses, even though it's 2 doses of the same vaccine, I think it's still important to have. And having 2 doses now doesn't preclude you from having a different brand vaccine later on, when, even when booster shots are recommended. So you're not sort of locked into a particular brand forever. I think that's also important to realize. Yeah.
There's a comment here saying, can we please let people know that if the staff member is not a Medicare recipient, that they can still access their flu vaccination at Peter Mac? They just need to speak to the vaccination provider.
Yes, that is correct. Good information.
Yes, and again, also for, I'm sure people are already aware, also for COVID vaccines. It is regardless of your Medicare status.
Are there other causes of the TTS syndrome presentation associated, albeit rarely, with the AstraZeneca vaccine, or is it exclusively a vaccine-related condition?
It's not a vaccine-related condition in the sense that we've always, as you know, in hospital used an anti-coagulant called heparin, anti-blood thinner heparin, for a very long time now across lots of hospitals. And a similar syndrome, although not exactly the same, called heparin-induced thrombocytopenia syndrome, is very similar in terms of how it triggers off clotting, but also low platelets. So it's not the type of condition that you see associated with the AstraZeneca vaccine, although rarely, is also associated with other medications like heparin. So it's not just a vaccine issue.
Is it likely that now that the risk seems higher of infection for younger people, that the advice regarding AstraZeneca might change?
Yeah, again, of course, I'm again not on the clinical committee that makes these recommendations, but they've always said in their advice and in their guidance document that it depends on the risks and benefits of what's going on in the community. And obviously, if there are lots and lots of cases, and there's unfortunately, touch wood, if there's a much larger outbreak or wave, then certainly the risk and benefit equation changes. So they then might change their recommendation in terms of access to AstraZeneca more beyond age limits. But they've always mentioned that that's always a consideration.
What can you tell us from the, I think it's overseas experience, about the percentage of AstraZeneca fully vaccinated people getting infected and ending up really sick? And is there any difference between this and just the people who get the Pfizer vaccination?
Yeah, so so the UK have done a fantastic job, and they certainly produce a lot of wonderful studies, what we call real world effectiveness studies of vaccination, and of both types, both the Pfizer as well as the AstraZeneca, and they've shown that both are equally good in terms of preventing severe complications from COVID, especially hospitalizations and ICU admissions and death. But the important thing, especially which I've sort of touched on earlier with the Delta variant, is the importance of having 2 doses of either vaccine.
The last question that we have at the moment, any tips for talking to vaccine hesitant people about vaccines without making them think that you're trying to indoctrinate them?
Yeah. Oh, look, that's a fantastic question. And I think, thank you for asking the question. I think it's important that all of us, have that conversation with friends, family, patients as well, about vaccination. But I think the most important thing is to have an open conversation. Firstly, I think the most important thing is to understand why they're worried and why they're particularly hesitant. And it could be something as simple as not knowing how to access the vaccine, to something more complex about their personal medical circumstance, to I guess more difficult positions where they don't believe coronavirus is real. But so I think there's a whole spectrum, and I think we shouldn't lump anyone who hasn't gotten the vaccine into the same category. So I think the first place to start is, I think, to understand why they're worried and why they're hesitant. And I think could be a simple answer to I guess a more complex and ongoing conversation with them. But I think having that conversation, I think it's a great start.
There's another question. If someone presented with TTS, would they receive platelet transfusion for the thrombocytopenia, or is that contraindicated due to the presence of clots?
Yeah, so again, I'm not a thrombosis expert, but certainly no, platelet transfusions are not recommended. There are management guidelines around the management of TTS across emergency departments, and of course our hematology and thrombosis colleagues are onto it in terms of very much set guidance. But essentially the treatment is to use what we call a non-heparin based blood thinner, and potentially also intravenous immunoglobulin therapy. But like I said, I'm not a TTS or thrombosis expert, but certainly giving more platelets through transfusions doesn't appear to be effective from my understanding.
Has PINMAC considered doing our own COVID vaccination clinic, and would that help boost our staff vaccination numbers?
We definitely did consider it, but it is a state-run program, so the state actually designated where the COVID vaccination sites would be, and also the health services that would run them. So not an option for us. And also we partnered very closely with the Melbourne, so just walking across the bridge, it didn't sort of make sense at the time to duplicate services. I think if staff are keen to have it but are having difficulty accessing it, again, have a chat with your manager around how we might be able to facilitate you getting to one of the hubs when there is an available appointment, bearing in mind that the Pfizer is appointment by appointment only, not by walk-in. So just a reminder of that, don't walk in expecting to be able to receive it at the moment.
Yeah.
Sorry, Ben. Next question says, how much lower is the risk of severe side effects of the second AstraZeneca vaccination in people under 40 years old? The reports only say it's lower in all ages.
Yeah, again, great question. I presume when you say the side effects is particularly related to TTS, but I think in general with the AstraZeneca vaccine, with the second dose, the more expected side effects like the aches and pains, headache, tiredness, certainly the rates of that is lower with the second dose compared to the first dose. But in terms of particularly about TTS, Very fortunately, overall, the risk of TTS with second dose of AstraZeneca is incredibly low. So it's, you know, 1 in about 600, 700,000 doses with the second dose. And unfortunately, fortunately, because it's rare, that people haven't been able to provide that sort of age breakdown, you know, by age group to see whether that's different by younger age versus older age in terms of the second dose, I mean. And I think, you know, that, so we only have sort of overall sort of data, which, you know, is very strongly suggested that it's even rarer.
That's all the questions that we have.
Great. And with 5 minutes to spare, I think we're very happy to do another one of these sessions. So again, if people have questions or more concerns that or something specific that they would like us to address around the COVID vaccination program, please just email it through to the comms team and we can set up sessions either addressing specific issues, or if we just want to do the live Q&A again, Ben and I would be very happy to facilitate that. Just a reminder again around the flu vaccine, and as you just heard on the overhead announcement, that clinic is now running, so please go down and make sure that you are vaccinated, or just fill in the RedCap database if you have had it elsewhere. Really important that we capture that data. And lastly, just a reminder again to make sure that you are looking after yourself, your family, your colleagues. Totally understand that this is a really stressful time with extensions of lockdowns in the middle of winter. So please, you know, be wary of the impact that that might be having on you and others around you, and sing out if you need help. Yeah.
My only other sort of additional comment is about how we had a vaccine clinic on site for our patients, and there was a queue to have that done, and we've been able to offer all the patients who wanted it around that time already, and we'll follow that up with second dose. But at the moment, we don't have an ongoing on-site clinic, but certainly our partners at Royal Melbourne, in terms of especially the AstraZeneca vaccine, across the road in Parkville, are open to patients as well. So that's a good site for if you encounter patients who are interested to have it, if you like, in a more hospital setting rather than in a mass vax setting, then certainly Royal Melbourne across the road are taking patients for AstraZeneca.
That's a good point. Thanks, Ben. Awesome. Thanks, everyone. And thanks to Jai for facilitating. Great job. Thank you, Ben. Okay. See you all next time.
Thanks, Jack. Thanks, Ben.